Oftentimes, she's referred to as the guru of population health. As a trained and practicing physician, she has a deep passion for population health strategy, early education, and advising new and upcoming companies on how to become more viable and scalable. She is currently a global medical director at HP and HPE. And without any further ado, please help me in giving a warm welcome to Dr. Archana Dubey.
Thank you, Sarah, for an introduction. I just want to highlight a couple of things. Unlike all of my preceding, speakers, panelists that I thoroughly enjoyed, I am not from IIT, so that's kind of the unknown territories. And then I'm also a physician, so that's another unknown territory. And also wanted to correct that. I actually parted from HPE. So as of about 6 months ago, to focus my attention into the healthcare division of HP Inc. And in that, I will also share some of the things that we are doing for solving, for example, the PPE problem or device problems for healthcare physicians on the front end. Let me share my slide real quick. And if there's any technical issues, you'll just have to oversee this. This is coming from the MD here. Okay, excellent. So welcome everyone. We are in the midst of a pandemic that defines us. And as a global medical director for a large organization, this is something that is a fire in the house that I'm burning off right now. And not just for HP, but as I consult with different large employers that have a footprint globally, we are seeing a new territory that we are venturing off with this pandemic. I've worked more than 20 years, actually 25 years now, in the healthcare space in different roles. And joining you today as a founder CEO of a not-for-profit organization that's tackling COVID-19 squarely. And today we go live, so a really important day for us. At HP, what I do is I design their health and well-being programs. What it means is we, just like Pat said, we are a leap year, several leap years ahead of health industry in innovation. We look at what our future needs are, and we are the early adopters of all of the technologies, whether it's AI, ML, doing predictive analytics, data modeling of our population, or point solutions that are tackling healthcare conditions like diabetes or hypertension. So I help design those for a larger population that's spread out throughout the world, and develop partnerships with healthcare systems across the world. Besides doing that handful or plateful of work, I also teach at Stanford. I'm a faculty there. And then partly because I love working with the future generation of healthcare providers to help them understand that, one patient at a time is important, but having to scale your skills is as important. I'm trained from Columbia and USC, so that also huge technology institutes, and I put myself to school for AI ML. So there is a technology side of me, maybe not so much knowing Zoom as well, but this. And then I founded 3 companies. 2 of them are active and running. One of them was a price transparency tool, and 2 are really driving innovation in the field, one from private sector and one from not-for-profit. So let me talk about, I have 2 parts of this conversation, and I was asked by Amit to focus both on COVID specifically as a clinician, and then also talk about AISquare. So why did we think of AISquare? When COVID arrived in our neighborhood, one thing we encountered is either we can become part of the problem and just respond to it, or become part of the solution. We found that a lot of researchers in Wuhan had so much information to share with us, but it wasn't reaching to the researchers and the clinicians. And so we wanted to create a platform, and we are able to create a platform as of today as a launch pad for the source of truth for both the researchers, general public, and students. that builds content and connection across the global community, empowering them to collaborate and solve real-world problems at scale. How we do that is by engaging our students at college level or university level, and they become our student correspondents, start reporting onto the research that's happening in the local or larger geographic communities, and sharing that and engaging the researchers to participate with us. In that way, we accelerate innovation, and innovators can come to our platform and are able to pick up any of these research things that would enable. We have industry leaders from both private and public sectors. As you could see, the president of Open Growth, Gunjan Sinha, is a co-founder with me, partner in crime. But we also have folks from NIH, for example, Steve Ferguson, people from privacy, AI, media, and MIT Media Lab, Ramesh Raskar, as you could see, one of the colleagues, and then also people who are student leaders and affiliates who are participating with us in creating this venture. Why are we talking about this today? Is we are in the midst of a pandemic. Misinformation is driving decisions. For our leaders, most apparent in the US, sadly. Critical need for effective communication and collaboration is needed for us to respond to this. So why us? Because this is a unique, unmet need that we are trying to solve. There is no solution that is purpose-built for the research and researchers at this point. So we are working on the source of truth and invention that has an oversight from the researchers who are building these inventions and discoveries for us. We are approaching this, being a physician, we are not approaching this just from the medical or hospital side. We are approaching this through technology. We are approaching this through big data, cloud infrastructure, privacy, government, and financial, legal, and risk approach. So these articles that you would be seeing in this research hub are not just focused on the medical side. They are here to tackle a planetary problem for any human need. Our opportunities for innovation and community contribution is for the students building a scientific appetite for the future of our student workforce. Engaging, and we're building opportunities for them to have research associate work with the internship work. And what we're noticing, most of the universities, including Stanford, that because of in-person learning being disrupted, these opportunities will become more real for our students. They want to be able to do remote opportunities with, for example, MIT. And how do we enable that? This platform allows them to collaborate with researchers across. And then, of course, our researchers don't belong in the bunkers. They need to showcase their work. They're generally shy as we profile them, and they don't have a marketing mouthpiece, so the students are becoming one for them. And then, of course, each one of your entrepreneurs who are looking for newer ideas, you could come to AISquare and find technologies that are already in the process of being published, and you can run with it and create solutions. For the community, we are creating a source of truth. We are also creating partnerships across private, public, and also governmental institutes. And we are eventually enabling equity of resources and information across the whole population. Okay, so with that, I would switch gears onto some COVID updates. All right, I was asked to give a quick COVID rundown. So here we are, 36+ million. Doesn't move anybody anymore, sadly. It's a number. So the population across the world is split into people who are touched by COVID-19 and people who are not. And for people who are not, it's just a number, and people who are, it's very painful, whether it's the lives or livelihood that are hurt. And the good news is that most people have recovered. The bad news is we have crossed about 1 million deaths across the world. And there are a couple of hotspots that we see, of course, the US and India. And it becomes really relevant for our conversation as we are in the IIT Bay Area chapter. I wanted to also talk about success story from that perspective. I'm talking to you about COVID. HP's response has been celebrated and highlighted across all of the arenas of COVID response from a large employer. This is an article from April 2020, but there are various ways HP responded to COVID-19 because we have a factory in Wuhan, and we responded internally by quickly making sure the families and our employees were well at the hotspots of COVID-19. We also responded by providing them PPE and having a good stockpile of PPE for our own employees. And then we quickly noticed that working from home is possibly the best way for us to quarantine people from the threat of COVID-19. And then we scaled this response to the outside world. So HP provided healthcare edition of the laptops and printers, which are the only existent technology that can be wiped down with a Sani cloth, which removes all of the viruses. And this was given to all of our first responders in New York, for example. I personally was involved in participating distribution in the Bay Area, for example. It saved so much of infection rate for our healthcare workers and first responders. On the PPE front, HP is the largest commercial 3D printing company. In Spain, the 3D printing division was able to print out parts of the PPE and also attachments to a regular mask that can mimic an N95. So there's, and of course, a swab that was printed out through 3D. So there are several innovations that they did in 3D printing that helped our healthcare community across the board throughout the globe. Coming back to COVID-19. So this is the vaccine update. This is the most common question that is asked in my COVID updates that I do for several companies. We have about 3,000 people live in my COVID updates at some point talking about wanting to know the source of truth. We have 11 vaccines that are in phase 3. As of last week, we have two more vaccines that have joined in the phase 3, which is very promising. As you could see, these are the vaccines that are in phase 3. I also talked about what are the different phases, and all those entrepreneurs who are out there can look at how do you accelerate some of the phased data approaches. How do you go from phase 1 to phase 2 to phase 3, and maybe help accelerate some of the vaccine developments. And of course, the University of Oxford AstraZeneca, which has huge partnership with India, and Pfizer, Novavax, and Moderna are the ones which are top contenders. Few things that I wanted to highlight, which are basic, but are very true. Short of a vaccine, your mask and your distancing and hand washing is what protects you. And one of the areas people forget is getting into an elevator, especially in dense areas. You're living in an apartment, making sure you're in a cluster space. This is where airborne happens. And as of last week, CDC has said that it is indeed an airborne condition in an enclosed space. Few of the symptoms, you could take your time to look at those. These are reference slides, and I don't need to preach the choir here. You probably know all of these, but I just wanted to cover those really quickly. One of the study that came around masks, because that's a big question that comes through, is a Duke study that looked at all these different types of masks. Highlight is, if you're sick or you're worried about exposure to COVID-19, use a surgical mask, and it is disposable. Please do not reuse it because it catches the virus and the virus gets stuck for about 5 days on it. Leave the N95s for the doctors, they need it. Please do not wear the gaiters or the scarves. They don't protect you. They definitely do not protect people around you. Here is another area for you for reference. What are the different surfaces that the virus stays longest? Do not use paper money. This is one of the big ones. So use contactless payment, and definitely throw away the tissue once you sneeze in it. Some of the commercial service interactions that you could do as the holidays are coming in, on both sides of the pond, you could look into how to interact with your environment in a safe way. And of course, Diwali or Thanksgiving or Christmas is coming up. You might be traveling. These are different ways for you to be safe while you're traveling, making sure that you do car travel instead of public transportation travel, and making sure you have the mask and hand sanitizer with you at all times. Some of the testing updates, as you know, we have the active infection test types, which is one is antigen, which is virus particles, and the other one is the PCR, which is actual genetic material of the particle. Both of those look for active infection. Antigen tests are quick ones, little bit less accurate. PCR tests are fast, are a little bit longer, sent out to the lab, and have this big old nasal swab that goes almost to your brain. That is a little bit more accurate. Both of these tests are looking for active infections. Don't jump up and down for the antibody test. We do not know how to use it as of now. It is not your immunity passport. And we are seeing that immunity may not last for more than 3 months. So this is only used when you are ready for donating plasma. Here are the reasons why we test. I've also included 10 things you can do to care for yourself. 2 things to remember. If you do indeed catch COVID-19, most of it is going to recover by itself. Self-care and self-isolation, these are 2 things, are the best ways you can protect yourself and protect your loved ones. There is an instruction guide for caregivers that you can protect yourself while caring for somebody sick at home. So I'll leave you with this thought. All of the entrepreneurs with this thought of, hey, pandemic will be come and gone. But what we are stuck with is a silent pandemic of mental health disease that's coming our way, second wave of urgent non-COVID conditions that already we are seeing. Hey, heart attacks did not stop, appendicitis didn't stop happening during this time. All of that care and cancer care got pushed out for a little bit later. That would be coming our way. And then of course, a third wave of pandemic is the chronic conditions we haven't cared for during this time that will come our way. So with that, I would close with some of the reliable information that you could get, both nationally here in US and globally across the world. I've included European and other resources, and I'll open up for question and answers.
Thank you, Archana. I mean, it was pretty insightful. I mean, it gives so much clarity on what we need to do during these times. And again, we have 2 minutes left, but I do want to take one question. So how do you recommend that the government and healthcare system remain prepared for a future with such a pandemic, right? Maybe through policy changes or through any kind of technology innovations that you were thinking, or any other approach?
Yes, and I think Amit was possibly part of the platform, the Invent Health platform, that I just literally had a pretty intense panel on healthcare and politics or policies. One of the most important things that especially our IoTians or a technology mix can do is create a network of digital connection between the key players or stakeholders across the country and globe. So when a pandemic like this happens, we're able to trigger a response in a much more effective way. And that includes data transfer in a secure and private way. That includes quick assessment of our hospital capacities, both on ventilators and patient care. It also triggers a quick response of where else can we tap into for capacity. We noticed that in South Korea, for example, they were able to work with Samsung, which is also one of our partners. And Samsung Print is actually now an HP Inc. company. We were able to borrow our buildings because we are working from home, and they became COVID centers where patients not so sick or very sick could be placed, so then the community does not spread the virus together. So we do need a digital network that can be triggered, and just like we used to have trauma team activation, we can activate a pandemic response globally and nationally with the resources across the board, from government, from public health, from health systems, and from insurers and payers who are truly impacted by this.
Sounds good. There's a light comment from one of our Q&As, Dr. Dubey for Congress. I would definitely vote. But thank you so much, Dr. Dubey. It was lovely hearing from you and extremely inspiring on the work that you're doing.